So then let's take a look at why it's a little bit hard for hospitals to disclose these costs or give you an upfront cost. The first giant thing is insurance. There isn't one insurance company in the US. We shop around for insurance. Everyone, it seems like, has a different insurance provider. And if they do have a different insurance provider, then they at least have a different plan. So you have different insurance providers with different plans. People can be on the same type of insurance, but they can have a different plan. And there's so much plans where each patient is a different negotiation in a sense. So each patient is going to have a different cost associated to their treatment. Everybody comes in with a different plan. Everybody is a different charge, which is why it's so chaotic, because they might have an idea of how much this surgery can cost the hospital, but just because the surgery costs X amount of money, they have a contract with the insurance provider of how much they're going to be charged for that procedure. Let's just say a procedure costs $50K, but they have a contract with Blue Cross Blue Shield that, okay, it costs us $50K, but we're going to charge the insurance $80K. And then we're going to charge the patient this much based on their plan. And these negotiations are done on closed doors, so nobody knows, nobody discloses their pricing. You cannot find an accurate number of what a hospital charges themselves to do a procedure, because it's done behind closed doors. People do not want this to be known. If the CEO of the hospital does not want this to be known, because there is an overcharge, because the hospital has to make money. So even though this is a nonprofit hospital, if a procedure costs you $50,000, they're probably charging insurance like $80K, $90K, $100K, depending on what they could squeeze out of them. And they don't want the public knowing, hey, this procedure technically costs us $50K, but we're overcharging you by $40K. Our price is going up 100% because we could get that out of the consumer. That's why it's so hard to figure out and keep things fairly transparent when it comes to these kind of things, because the big chunk of the negotiations are handled at closed doors around a round table that nobody besides the people in that room know. And they don't want to talk about it because it's very private, because they are making money. And people are going to get really, really upset if they find out that, hey, hospitals are charging insurance companies 100%, because I think about it. If the hospital is charging the insurance $40K more for a procedure, that insurance has to give that $90K, but who is paying for that $40K, right? The people are. We're paying for that money. We're paying for the hospital profit, but then again, the insurance also has to have a profit, right? So we're also paying for the profit for the insurance. So a procedure might cost $50K. The hospital might get paid $90K for it, but as an insurance company, you might charge $120K for it. So on top of that, the insurance is making $30K. So the hospital making $40K, the insurance is making $30K, and who's paying those people? We are, the people that are insured, the consumers, because we're you could say the bottom of the totem pole, we're where the money comes from. Without us, there is no money, so they're going to charge us as much as they can, because the insurance has to meet its quarterly revenues, has to upcharge, the hospital has to upcharge as well to stay standing, to make the next quarter revenues and be a successful business.